stop what you are doing right now, because in the next few minutes, I'm going to tell you about a virus that is quietly moving through rural America, through suburban garages, through vacation cabins, through garden sheds and storage barns. And it is doing something that almost no other virus does. It is killing otherwise healthy adults, people in their 60s and 70s who felt completely fine just 48 hours earlier, by drowning their lungs from the inside out. No warning, no time to prepare, no antiviral drug to reach for. It is called Hantavirus Pulmonary Syndrome. And today I'm going to walk you through exactly what it is, what it does to your body step by step, who is most at risk right now, and most critically, the 5 things every adult over 60 must do this week to protect themselves and the people they love. If you are new to this channel, I am a physician and medical researcher who has spent decades studying how infectious disease behaves differently in the aging body versus a younger one. The difference, as you are about to discover, is not small. It is the difference between surviving a pathogen and not surviving it. According to data published by the Centers for Disease Control and Prevention, the case fatality rate of Hantavirus pulmonary syndrome sits between 38 and 50%. That means nearly 1 in 2 people who develop the severe lung form of this disease do not make it out of the hospital, and adults over the age of 60 whose immune systems have naturally declined in ways I will explain shortly are among the most vulnerable people on Earth to this virus. Before we go further, I want to ask you something directly. Have you been near a cabin, a storage shed, a barn, a crawl space, a parked vehicle that sat unused over winter, or any enclosed space that mice or rodents might have accessed in the past 2 months? Think carefully before you answer, because the answer may be more important than you realize. Drop your response in the comments below. I read every single one. Here's how today is structured. I am going to take you through everything. What Hantavirus pulmonary syndrome actually is, how it enters your body, what it does once it is inside you hour by hour and day by day, real cases of real people who have been through this. And then I am going to give you the 5 most important protective actions ranked from critical all the way up to the single most powerful thing you can do right now. I need you to stay until number 1, because number 1 is the action almost no senior is taking. And the reason why is something that genuinely surprised me when I looked at the data. Let us start from the beginning. What exactly is Hantavirus pulmonary syndrome? Think of your immune system as a security force stationed at every entrance to your body. Now imagine a threat so microscopic, so precisely engineered by millions of years of viral evolution that it does not knock on the front door. It floats in through the ventilation. It bypasses your first defenses entirely. It travels directly into the deepest tissue of your lungs and begins dismantling the walls of your blood vessels from the inside. That is Hantavirus pulmonary syndrome. The virus responsible belongs to a family called Hantaviridae. In North America, the primary strain causing severe illness is called sin nombre virus, which translates from Spanish as the virus with no name. It was first identified in 1993 during an outbreak in the Four Corners region of the American Southwest, where a cluster of previously healthy individuals died from a mysterious respiratory collapse that baffled physicians for weeks before the cause was finally isolated. The natural reservoir of this virus is the deer mouse. The deer mouse does not get sick from carrying it. It simply sheds the virus constantly and silently through its urine, its droppings, and its saliva into whatever environment it inhabits. A garage, an attic, a basement, a cabin that was closed all winter, a shed at the back of a property, the interior of an old camper van parked in a field. Any enclosed space where deer mice move becomes a potential reservoir of aerosolized viral particles that no human eye can detect. There are other strains around the world. In South America, a strain called Andes virus has caused documented outbreaks in Argentina, Chile, and Brazil, and carries the terrifying distinction of being the only known hantavirus strain capable of spreading from person to person through close contact. In Asia and Europe, different strains attack the kidneys rather than the lungs, causing a condition called hemorrhagic fever with renal syndrome. But in North America, it is the lungs that bear the full force of this infection. And after the age of 60, your lungs are fighting this battle with significantly reduced reserves. How the virus enters your body. The primary route of infection is one that most people never think about. You breathe it in. When infected rodents shed the virus into an enclosed space, the viral particles attach themselves to microscopic dust particles suspended in the air. They become aerosolized, invisible, odorless. completely undetectable without laboratory equipment. When you walk into that space, when you open a box that has been sitting undisturbed for 6 months, when you sweep a dusty floor or move stored furniture in a basement, you inhale those particles. They travel down your airway. They reach the deep lung tissue, and the infection begins. Research published in the journal Emerging Infectious Diseases has confirmed that the virus can remain viable and infectious in the environment for several days and in cool, sheltered, low humidity conditions, potentially longer than that. Secondary routes include direct contact, touching rodent droppings or nesting materials, and then touching your face, eyes, or mouth. Rodent bites can also transmit infection, though this is less common. And as I mentioned, the Andes virus strain in South America has documented cases of human-to-human transmission, which is why researchers are monitoring it with considerable attention. Now, here is the part that every adult over 60 needs to hear directly. After the age of 65, your mucociliary clearance declines by approximately 30 to 40%. Your mucociliary system is the network of tiny hair-like structures lining your airways that trap and sweep out foreign particles before they can penetrate deep into your lungs. It is your first mechanical line of defense against inhaled pathogens, and it is significantly weaker in your body today than it was 3 decades ago. What a 35-year-old might partially clear before it reaches the deepest lung tissue, a 68-year-old is far more likely to have penetrating all the way to the alveoli. Those are the tiny air sacs where oxygen enters the bloodstream, and that is precisely where hantavirus does its most catastrophic damage. What the virus does inside your body hour by hour. This is the part I need you to pay the closest attention to. Understanding the progression timeline is not just medically interesting. It could be life-saving. The incubation period, the time between exposure and the appearance of symptoms, ranges from 1 to 8 weeks. Most people develop symptoms between 2 and 4 weeks after initial exposure. This long, silent window is one of the most dangerous features of this virus. You can feel perfectly well. You can have no idea whatsoever that a biological storm is building inside you. The illness begins in what physicians call the prodromal phase. Think of it as the sky darkening before a hurricane makes landfall. For the first 3 to 5 days, the infected person experiences symptoms that feel almost identical to influenza: fever, deep fatigue, muscle aches concentrated in the large muscle groups of the thighs, hips, and lower back, headache, dizziness, sometimes nausea and vomiting, occasional chills. At this stage, even physicians who are not specifically looking for it will not immediately suspect hantavirus. They will consider influenza COVID-19 or a common viral syndrome. This is the window during which the virus is quietly replicating inside the cells that line your blood vessels, cells called endothelial cells, and beginning to compromise their structural integrity. Then everything changes. Within 4 to 10 days of those initial symptoms, the disease enters what is called the cardiopulmonary phase. And this is where people end up in the intensive care unit. As the endothelial cells lining the blood vessels in the lungs lose their integrity, fluid begins leaking out of the bloodstream and flooding the air sacs. Your lungs, which should be light and airy like a dry sponge, begin filling with liquid. Breathing becomes difficult, not a mild shortness of breath, a terrifying gasping inability to pull enough air. Oxygen levels in the blood drop rapidly. Blood pressure falls. The heart, struggling to pump effectively without adequate oxygen, begins to fail. Hantavirus Pulmonary Syndrome can progress from the first sign of breathing difficulty to complete respiratory failure in as little as 24 to 48 hours. Many patients require mechanical ventilation and ICU admission within a single day of their breathing becoming compromised. This is not a disease that gives you time to wait and see. Patients who survive the cardiopulmonary phase, and with modern intensive supportive care, many do, enter a recovery phase during which the kidneys begin expelling the accumulated fluid from the lungs. But recovery takes weeks to months, and a significant number of survivors report persistent fatigue and reduced lung capacity that lasts for years. There is currently no specific antiviral medication approved to treat hantavirus infection. Treatment is entirely supportive: oxygen, mechanical ventilation, fluid management. Time. You cannot go to a pharmacy and fill a prescription for this. Prevention is not just important. Prevention is everything. Real cases, real people. I want you to understand that this is not a theoretical concern. These are documented cases. In 2012, a cluster of 10 confirmed hantavirus infections was linked to tent cabins at Yosemite National Park in California. 3 of those 10 individuals died, The CDC investigation found evidence of rodent infestation in the insulation of the cabin walls. Thousands of previous visitors had to be notified and monitored. The outbreak forced a complete structural redesign of the affected cabins and made national news. In 2020, a man in his early 60s from Washington state spent a weekend cleaning out a long unused storage barn on his rural property. He was a retired farmer in generally good health. He wore no respiratory protection because he had done similar work dozens of times before without incident. Within 2 weeks, he developed what he believed was severe bronchitis. He was hospitalized and placed on a ventilator within 48 hours of admission. He survived after 18 days in the ICU. He spent the following 8 months in pulmonary rehabilitation. His breathing capacity never fully returned to what it had been before. In Colorado, Utah, and New Mexico, states within the historical endemic zone of Sin Nombre virus, public health departments report sporadic cases every year, particularly during spring and summer when rodent populations peak and people spend more time in outdoor structures. In 2023, the Colorado Department of Public Health confirmed 3 cases of Hantavirus Pulmonary Syndrome. 2 of those 3 involved adults over the age of 65. 1 did not survive. These are not rare statistical outliers. They are predictable outcomes when an aging immune system encounters aerosolized hantavirus particles in an enclosed space. The 5 things every adult over 60 must do this week. Now I'm going to give you the 5 most critical protective actions, ranked from important all the way up to the one action that could make the difference between a close call and a tragedy. Stay with me for number 1. It is the step almost nobody is taking. And number 5, conduct a complete rodent audit of every enclosed space on your property. Not next month. This week, your garage, your basement, your attic, your garden shed, any outbuildings, your crawl space, any vehicle that has sat unused for an extended period. You are looking for droppings which appear as small dark grains approximately the size and shape of a rice grain, gnaw marks on wood, plastic, or packaging materials, nesting materials made from shredded paper, fabric, or insulation, grease marks along walls and baseboards where rodents travel repeatedly, and a distinctive musty odor associated with active infestations. Do not enter any enclosed space and begin sniffing around in low enclosed areas without protection. Open doors and windows first. Allow the space to air out for a minimum of 30 minutes before entering. If you find evidence of rodent activity, do not disturb the area until you have the correct protective equipment. Which brings us to number 4. Number 4, use correct personal protective equipment every single time. When entering any space with evidence of rodent activity, you must wear a certified N95 respirator mask. Not a surgical mask, not a cloth mask. A certified N95 that creates a tight seal around your nose and mouth and filters at least 95% of airborne particles. Surgical masks allow air to flow around their edges. They provide essentially no protection against aerosolized hantavirus particles. You also need disposable nitrile gloves to prevent direct skin contact with droppings or nesting materials. If the infestation is significant, a disposable Tyvek coverall or old clothing that can be immediately bagged and washed in hot water is strongly advisable. I know this sounds extreme for a trip to the garage, but consider this. A complete set of protective equipment costs approximately $15 to $20 at any hardware store. The average cost of a single day in an intensive care unit runs between $3,000 and $10,000. And no amount of money restores the lung function lost to Hantavirus Pulmonary Syndrome. After age 75, the body loses approximately 35% of its pulmonary reserve. That is the extra breathing capacity your lungs call on when they are under physiological stress. You have less biological margin than you think. Protect it accordingly. Always pre-ventilate any contaminated space. Open all windows and doors and allow fresh air to circulate for a minimum of 30 minutes before entering. This significantly reduces the concentration of aerosolized viral particles in the enclosed air. Number 3, use the correct cleaning protocol. This one step could save your life. If you have found evidence of rodent activity and you are ready to clean it up, there is one instruction I need you to commit to memory right now. Never dry sweep. Never use a vacuum on dry droppings. Never use a leaf blower or any device that moves air across contaminated material. These actions aerosolize the virus particles and create a cloud of infectious material that travels directly into your lungs with every breath you take. The correct protocol, as recommended by the CDC, works like this. Thoroughly wet the entire affected area with a disinfectant solution. either a commercial disinfectant labeled as effective against viruses or a mixture of 1.5 cups of household bleach per 1 gallon of water. Allow the solution to soak for at least 5 minutes. Then, while wearing your N95 and nitrile gloves, use paper towels or disposable cloths to collect the dampened material and seal it immediately inside a heavy plastic bag. Double bag it. Dispose of it in a covered outdoor trash container. Wipe down all surfaces where rodents have traveled using the same bleach solution. Mop hard floors with the solution. Steam clean carpets if possible. This wet cleaning method reduces your exposure risk by an estimated 90% compared to dry methods, according to guidelines from the New Mexico Department of Health. For an aging immune system, this is not a technique upgrade. This is the line between a manageable risk and a potentially fatal one. Number 2, know the specific symptoms that demand emergency action. The window between the onset of hantavirus symptoms and the point of no return is measured not in days but in hours. Knowing what to look for and acting on it immediately is the difference between early supportive intervention and arriving at the hospital already in respiratory failure. Here's the specific symptom cluster that should send you to an emergency room immediately. Not urgent care, not your primary physician's office in 2 days, an emergency room today. Fever above 101 degrees Fahrenheit, combined with deep muscle aches, especially in the thighs and lower back, combined with shortness of breath that is worsening progressively over the course of hours, even if the breathlessness initially feels mild, in any person who has had any potential rodent exposure in the past 1 to 8 weeks. When you arrive at the emergency room, you must communicate this directly and clearly to the treating physician. I may have been exposed to hantavirus. I was near rodents or a potentially contaminated space. Please test me for hantavirus exposure. Do not wait for the physician to connect the dots. In a busy emergency department, hantavirus is not at the top of the differential diagnosis list for someone presenting with fever and muscle aches. You are your own most important advocate in that moment. Research published in the Annals of Internal Medicine found that patients who communicated a potential hantavirus exposure history to their treating physician within the first 24 hours of respiratory symptom onset had dramatically better outcomes than those whose exposure history was identified late. Early recognition means earlier access to ECMO, extracorporeal membrane oxygenation and artificial lung support system, and earlier intensive supportive care. That early access is what survivors have that many non-survivors do not. One critical physiological note for adults over 65. Your inflammatory response in older age becomes what researchers at Stanford University School of Medicine describe as inflammaging, simultaneously weaker and more dysregulated than it was in younger years. This means you may feel less sick than you actually are during the prodromal phase. Your body may not generate the robust early warning signals that would prompt a younger person to seek care. Take symptoms seriously. Act faster than you think you need to. Number 1, have a specific informed conversation with your primary care physician before you enter any rodent-prone space. I know you may have been expecting something more dramatic, but here is why this is the most powerful action on this entire list. A survey conducted by the American Geriatric Society found that fewer than 8% of adults over 65 had ever discussed zoonotic disease risk, diseases transmitted from animals to humans, with their primary care provider. Fewer than 8%, and yet your physician can do something for you that no amount of protective equipment or cleaning protocols can accomplish on its own. They can assess your individual immune status and identify whether it is more compromised than average. They can review your current medications. Certain antihistamines, corticosteroids, and blood pressure medications can suppress immune response in ways that increase your hantavirus vulnerability significantly. They can document your risk profile in your medical records so that if you arrive in an emergency room with respiratory symptoms, the connection to potential rodent exposure is immediately flagged. And they can ensure you are identified for priority evaluation and potential transfer to a facility with ECMO capability if you do become seriously ill. There is no vaccine for hantavirus. There is no antiviral prophylaxis you can take in advance. But a well-informed physician who knows your exposure risk and your immune profile is your most powerful early warning system, your most effective advocate in an emergency, and your best chance of a rapid, accurate diagnosis if the worst happens. Here is exactly what to say at your next appointment. Print these words out if you need to. I want to talk about my risk for hantavirus. I live in or visit areas where rodent exposure is possible. I want you to know this, and I want it in my record so that if I ever arrive somewhere with breathing problems, the connection is made immediately. What should I know about my specific immune profile that is relevant to this risk? That conversation for a 70-year-old woman who summers in a mountain cabin or a 74-year-old man who tends a rural property could be the most important medical conversation of the year. What I want you to take away today. You now know something that most adults your age, and honestly most people of any age, do not know. You know what Hantavirus Pulmonary Syndrome is and how it has earned a case fatality rate that puts it among the most dangerous respiratory illnesses in North America. You know how it enters the body. You know the silent incubation window that makes it so insidious. You know the prodromal symptoms that disguise it as ordinary flu. You know the cardiopulmonary collapse that can follow within 24 hours. You know the real cases of real people whose lives were permanently altered by a single unprotected afternoon in a barn or a shed. And you know the 5 things that change your odds dramatically. Audit your spaces. Get the N95 and the gloves. Use wet cleaning protocols. Memorize the symptoms that demand emergency action. And have that conversation with your doctor before you need to have it in an emergency room. These are not complicated steps. They are not expensive steps. But they are the steps that separate people who are protected from people who are not. Your independence matters. The ability to open your own cabin in spring. To clear out your own garage on a Saturday. To putter in your garden shed without fear. These things are not trivial. They are the fabric of a full active life at 65, at 75, at 85. And it is absolutely within your power to protect that life starting this week. If this information was valuable to you today, please take 5 seconds right now and click the like button and subscribe to this channel if you have not already. Every week I bring you information exactly like this, specifically researched and specifically designed for adults over 60. Information your physician may not have time to cover in a 15-minute appointment. Share this video with one person you care about. One person, a spouse, a sibling, a neighbor with a rural property. That share costs you nothing and it could matter more than you know. And now I want to hear from you. Drop your answer in the comments. Have you ever cleaned a space that might have had rodent activity without wearing any protection? And what from today surprised you the most? I read every comment. Your answers genuinely shape what I cover next. Thank you for being here.